Hey everyone. I thought I got in here a couple minutes early, so for a bit of context, I will do a quick intro. Something I don't normally do because I forget to. Today we've got Dr. I don't know. He's a doctor. This man is a doctor, so we can't show you his face on TV. Fuck, I'm an idiot. Just listen.
There are improvement works ahead, so this train will terminate at the next station.
Fake news, folks. Fake news.
Are you Muslim?
Dude, look, we're here to just have a convo.
Yeah.
Alright? And you don't have to name names, we don't have to name you. You can just be Dr. X.
Dr. X.
Okay? You literally sound like a Marvel supervillain.
That was actually what was coming to my head when I was coming in. I was like, Dr. X, huh?
Yeah, Dr. X.
Dr. X.
You know what I mean? It's funny how there's so many, I think was it in The Big Bang Theory? He said that Sheldon once mentioned that so many villains had like advanced degrees. Like, how did all these super villains?
I don't even watch Big Bang Theory.
Neither do I.
And I remember, for some reason, I remember that.
Yeah.
And thinking back, they do. Yeah. they literally do.
All right. Okay, so look, we're not going to. All right, so you're Dr. X. Okay, we've had Lawyer Y in here, so you're Dr. X.
Yep.
I'm going to have a whole panel of
X, Y, Z. Yep.
Yeah.
Awesome.
Advanced.
That's right. All the letters of the alphabet.
I'm serious. All right, we'll call you Dr. X. And the reason why I brought you down here was literally to get an idea of what you do, just for a bit of context, okay? Like we said, we don't have to mention where, and what your role is in how you're dealing with basically the current pandemic, okay? Because I said this to you a little while ago. I said about a year and a half ago, man, when COVID first sort of reared its head, so start of March, April 2020, I brought in a microbiologist, okay, whose fucking field was literally infectious diseases. And she was on the long-term unemployed list in this country. For what reason? God knows, because we couldn't use someone with advanced knowledge in infectious diseases at the start of COVID. Like, no use for people like that. Yeah. To the point where she's left the country now, okay? So I brought her in twice to give a little pep talk on what the hell COVID is, and it obviously didn't take. So I figured the next sort of step up would be to get someone on the front lines and give us an idea of what actually is going on. Okay, how it changes, how it affects a health worker on the front line. Like I said, all anonymous. Okay, you don't have to name names. All right, I'm not bringing you here to do that. Obviously, your credentials speak for themselves. It's just literally insight, man. That's all I want.
Yeah, no. Of course.
So, just a bit about yourself, man. You've mentioned your education. Do you want to start like from the start, post high school? Just a bit of background on yourself.
So post high school, I finished my Bachelor of Science, majored in physiology, did some not microbiology, did some developmental anatomy as well. From there, I sat the GAMSAT, got into medical school, and have last year completed my internship. That was rurally based. And this year I've started working in a Melbourne Metropolitan Hospital.
Most internships are all sort of rurally based. They try and push you out there for a while.
No. So there's actually a way they do it. It's sort of very similar to the way you apply for universities in VCE.
Yeah.
So you put all your preferences down and hopefully you get your first preference. Yeah. But sometimes you get a little bit unfortunate. And some people will get a preference that they didn't have on there either. Okay, so this is luck of the draw, really. It's a little bit of luck of the draw.
Okay.
It's a bit of a luck of the draw.
Okay, so you've been, you're still studying, you said you're doing your Masters at...
So I'm doing a Masters with University of Sydney.
Yeah.
Masters of Critical Care. The plan is to do anaesthetics long term.
Anaesthetics?
Yeah.
Why? Not why.
No. Just the phys and pharm is what I enjoy about it.
Yeah.
So I love pharmacology, love physiology, bit of a nerd in that sense.
Yeah.
And
you'd want. I think the general hindsight is you'd want your doctor to be a nerd of some kind.
Of course. No, but I feel like anaesthetics is one of the fields where you're more so. I guess you can see the physiology or the pharmacology working right in front of you. You give the medication, see an immediate response.
Yeah.
Whereas
It's like real-time response.
exactly,
to
yeah.
theory.
And you've got full monitoring on the patient. It's quite satisfying.
Yeah.
You look at every other field of medicine, and I actually have enjoyed every rotation that I've been placed in. Every single rotation I've enjoyed, but I've got to say, all other parts of medicine, it's a little bit of a slow burn.
Yeah.
So you introduce a medication, you introduce a therapy, and it takes some time to actually see an effect.
Okay, can I ask you, how long have you been in say, after post high school, let's say from your first year of uni to now working as your resident doctor?
Yeah, resident doctor.
All right, so you're a resident doctor. How long has that sort of all been?
So following uni, it probably took about 8 years. Took a bit of a break in between as well.
Yeah.
And the break I took was to sit the GAMSAT, which is the medical entry exam.
Yeah.
And I thought it was best my grades were good in my undergraduate degree, but I needed to make sure I got a very high grade
heavy.
during my GAMSAT to be competitive enough to get into medicine.
Yeah, okay. What was I going to say to you? What was your motivation, man, to get into when did you know you wanted to be a doctor, first of all?
Well, during high school, but I went to a pretty crappy high school. And probably wasn't the best start.
Dream shatterers.
No. It was look. I'm probably the only doctor from my year level, from what I know.
Yeah.
Most people didn't go to university after high school.
Most of my
yeah. So
my high school was either in jail.
Yeah, exactly.
Yeah.
And I remember during high school talking about it and being like, look, I think I want to do medicine, and people not laughing, but people smiling, and there's not really like
it's like
you're a bit of a drop, not you're a drop kick, but yeah, the odds are against you.
Where are you going, mate?
Exactly. And going on from there, I think that sort of became my motivation to push on anyway.
Did you do any subjects in high school that would have related straight to medicine?
Biology, chemistry.
Okay. Do you reckon they're well nurtured in high school? Obviously, depending on what school you're in. I'm assuming.
Do
you think your formative years were nurtured in regards to where you want to take your career? Because, look, when I was in year 11, 12, I had no fucking idea what I wanted to do. I knew what I wanted to do. It was nothing to do with anything scholastic. You know what I mean? And to be perfectly honest, when it came time to graduate and pick, electives for, going into uni or TAFE, whatever, I had no idea. Someone did not for me. Do you know what I mean?
Yeah.
So what was it like for you? Like moving on? Was it easy to sort of map?
Good question. So I think my interest in exercise, health, and all that sort of stuff sort of got me into that. Actually, what made me interested in medicine. Like I wanted to learn more about the human body, your anatomy, your physiology, all that sort of stuff. You want to learn about how medication works. You find that kind of interesting. Doing biology, I did biology quite early on. So I did VCE biology when I was in year 10. Yeah. And that was probably the start of it. When I started doing bio, I'm like, oh, this is kind of cool. I didn't do great in bio, but it was, it was an introduction, and I could see myself doing this long term. Then chemistry was something I enjoyed. And then physics was something I dropped out of because I didn't have the motivation to pursue. But my brain actually, I've got to say, in that regard, that sort of formulaic way of thinking and problem solving is probably the way my brain works. And I understood physics. I understood maths very well. I just didn't pursue them. Yeah. Out of effort. But when I had to do the GAMSAT, I had to go over all those topics from the start. So I had to go over pretty much year 11, year 12, university level, chem, organic chem, physics, biology, all from the start. My
brain is hurting. Just
No, but it's all from the start because the GAMSAT's it's a 6-hour exam. You've got 3 hours of science. You've got an hour and a half of, I think it's an hour and a half of humanities and then 1 hour of essays.
This is to get your foot into
This is to get an interview. And then so if you have to get a top grade on the GAMSAT. So to get an interview, usually when I was entering medical school, you needed pretty much a perfect undergraduate degree score. So pretty much you needed to HD everything. Yep. You needed a perfect GPA. And then you also needed pretty much a top score on the GAMSAT. And that means being like the top of everyone that's sitting the exam, I think at least the top 5%. And this is everyone sitting the exam to get into medicine. So not everyone sitting the VCE exam.
Yeah, you're not versus guys that are going into trade school.
Exactly. I didn't get an awesome ATAR score. I mean, I did all right, but like I didn't get 99 or anything like that. But what you find is those people that went to the private schools and the people that did get those really high scores, they had a lot of, I guess, background help. They had tutoring. They came from a very financially well-off family. They pretty much had everything.
So you think there's a link between private schools and public school sector?
Well, what I was going to say is you actually see the difference between the person that sort of got not pushed, but got that assistance to get that great, fantastic score, and then the person that really wants to do it. Yeah. Because at that stage, you don't have all that assistance, and it's really up to you. You're competing against everyone that wants to do this, wants to have the same career pathway as you.
Yeah.
And that's when things become a bit different. And if you're persistent, a lot of people gave up after the first or second attempt. I did 3 attempts. First one was shit. Second one was all right. Third one, I went all in, treated it like a job, studied from 8 till the morning till 8,
Your
10,
face is
10
breaking up just thinking.
It was like 12 to 14 hour days getting ready for the GAMSAT, because the science section was okay for me, but the section on humanities and the section on essays was a section I did very poor on normally.
Yeah.
And then I managed to get my essay section to barely passing the GAMSAT, so pretty much in the lowest like quartile or whatever. I managed to get in the top point, I think like top 0.5% or something of essays. So I did amazing. That's actually what lifted my score. But in saying that, I was writing, as well as doing 3 hour science sections every day, and then studying the topics I need a little bit more knowledge on.
Yeah,
I was writing like 6 essays timed a day.
Time.
So half an hour an essay.
You time yourself.
Half an hour an essay.
Pumping out an essay.
So I do 2 in the morning, 2 in the afternoon, 2 at night, in between the rest of the study. So, but this was me being like, this is it. I want to do this. This is my barrier. I've got to overcome the barrier. So I'm going to put all my effort into that and take it from there.
Yeah, it's persistence. Like, you knew exactly what you had to do to break through, and that's what you did.
Exactly.
You got to remember, man, like with anything we're sort of discussing, you've got to treat me like a layman, a complete layman. You got to break things down to like baby talk, purely because I don't want anything lost in translation, man. I want this to be 100% clear. And even just mentioning just the studying that you had to do to get an interview into school. That's for me, that's like in the sitcoms or the cartoons where someone's just staring at all these science related Greek, Latin alphabet sort of shit just starts flying over their head, and they're like, what the hell is this guy talking about?
Simplify it.
Yeah, no. I'm just saying, like, that's what it feels like, because it's like, Jesus Christ, you are actually an individual that has studied his balls off to get to where you are. You know? There's different variations of success, but one thing I'll always respect is medicine and science, purely for the fact that you have to grind just to get a knock, just to be able to sit in front of the people that can say, hey, yeah, okay, so you want to start something here, you know?
That's actually a really interesting concept, or I guess idea. The fact that I guess medicine's one of the great ones in that if you pursue medicine, in terms of job prospects, you always have a job.
Yeah.
Doesn't matter. As long as you've got a medical degree, you will always have a job. But all other sectors of science, it's exactly what you just said as well. It's grind. And they're grinding. Sometimes they're grinding even harder, especially people doing their PhDs, like your friend, the microbiologist, and so on. There's a lot of work that goes into that for very little return. So that really does requires, that really has earned itself some respect in that regard.
We'll skip forward, right? You've done your, how much time did you do, say, like, out of uni, you started going through the paces, you started collecting, certificates and and kept going. How much sort of prac did you have to do before you became, like, say, in your residency?
When you say prac, do you mean how many, like
just out in the field, basically doing real world sort of stuff, as opposed to...
Okay, so you do your internship for a year.
Yeah.
And there's 3 core rotations that you've got to complete. That's emergency medicine, so working in the ED.
Yeah.
Your surgical internship, so that's 3 months of a surgical rotation. Usually that's general surge, so it's just like anything within the abdomen is a good way to think about it. And you're not actually performing surgery, you're just dealing with surgical patients. So you're looking after them while the surgeons do their thing.
Yeah.
And then you do a medical rotation. And medical rotation is just pretty much anything and everything that comes into the hospital that requires like a hospital stay. So it's Gen Med is just pretty much, so to break it down, it's just like if you've got pneumonia, if you've got heart failure, I mean, and it's not severe enough to get you into a respiratory department or a
you're not in
cardiac.
ICU.
Yeah. Oh, no. You're not in CCU. You're not in the respiratory ward. You're not whatever. And you've got multiple problems. You end up in Gen Med. So it's just these complicated patients that you just usually, although everyone has all these different problems, they all get pretty much the same treatment, which is steroids, fluids, and like antibiotics. So
why?
Yeah.
Why is that? It's just because
just the nature of the diseases that they have.
So it's always lead back to steroids.
No, it's so corticosteroids. So they're catabolic steroids. They pretty much reduce inflammation and usually make people feel a lot better. But the reason why that's usually the treatment is because it's a bit of I guess with these Gen Med patients, a bit of a balancing act. They've usually got an issue with their heart. They've got an issue with their lungs. They've got an issue with their kidneys. They've either got, and diuretics, that's the other one. So steroids, antibiotics, and diuretics. And then maybe fluids if their blood pressure is low. So it's a bit of a balancing act between all of that.
Sounds chaotic, man.
Oh, it is. It is. But like, as time goes on, you get more comfortable with it. You get an idea of what you're treating and what your outcomes are, what your goals are. So you get a sense of what needs to come into hospital. You get a sense of when someone's ready to get out of hospital and, how they should be cared in between.
You're sort of seeing symptoms. You're sort of seeing development. You're seeing a track of general patients. Like,
although that's what I'm seeing now, especially on one of the rotations that I'm on currently, is very different to what I want to specialize in. It's really nice to see that trajectory and see the end result.
Okay. What was it like being in ED?
ED, so last year in the country, this is the great thing about doing your internship in the country. You get to do quite a bit very early on as a junior. Usually they're usually understaffed.
Yeah.
So you get to take on a little bit more responsibility. If you want to do certain procedures that you wouldn't otherwise do until your second, third, maybe fourth year in a city hospital, you might get to do it very early on.
So you're exposed to a lot of stuff and just thrown in the deep end, basically.
Yeah, thrown into the deep end. And although it's understaffed, sometimes you get more support because there's fewer people and you get closer with the people that you're working with. Your senior staff are more likely to, supervise something and, help you out somewhere. So in that respect, you sort of get more opportunities to.
Man, I got to say, over the last sort of 18 months, 2 years, I've spent a bit of time going in and out of EDs and ICUs and things like that. So I've seen it, I've seen the frantic nature of how quickly these departments can get overwhelmed.
Yeah,
if that makes sense.
That's a big issue, and especially currently when we're talking about the COVID situation.
And even just, I think what people sort of fail to realize is you're not only dealing, say, with the current pandemic, but you're dealing with anything that pops off. I mean, you ever been in Dandy ED at 2 a.m, man? You got anyone walking in. You've got people on ice coming in, that they're trying to subdue. You got some dude that's cut his leg off by accident. It's all random shit. You got an old guy who's keeling over because of pneumonia that was left undiagnosed. So I've just overwhelmed is the nicest way I can sort of put it. The way I can say it to myself without giving myself an anxiety attack.
Yeah. So what has been happening? The threshold in terms of what's required to come into hospital has gone up and up and up. Unless you're super, super sick, you're not coming into hospital because we don't have the room for you. And that's what it was like during COVID.
Well, we're still there.
Well, we still are. Well, actually, it is getting better.
Yeah.
I can speak from experience where I'm working at the moment. The amount of COVID positive patients that we have has gone down, and I attribute that almost solely to our vaccination rate currently.
Yeah.
Because I saw a massive drop in the hospital admissions and the amount of people that we were caring for, the amount of MET calls, which is an emergency call, the amount of code blues that I was hearing over the announcements. they have gone down significantly in the last 3-4 weeks.
Code blue, meaning?
Oh, so code blues are...
I haven't watched enough ER, man.
Yeah, so Met call's like an emergency call, so their vital signs are... So their blood pressure, their heart rate,
then I know exactly
their respiratory rate,
yeah,
their oxygen levels are out of the normal ranges. We need a team of experts to come and review this and sort it out.
Man, those moments, I can say, just give me PTSD, man. Like I'm remembering like ICUs that I was in, and just seeing swarms of dudes just suddenly running into a room around a guy on a bed. You know?
So in an ICU, what would be happening is more code blues than Met calls. Met calls would happen on the other wards, and usually an ICU doctor or a very experienced ICU nurse would be going to the Met call as well as a medical doctor.
Yeah.
So it'll be a registrar, a medical registrar, usually. Usually the home team of that patient, so the medical team of that patient, as well as a member from ICU, whether that be an ICU registrar, whether that be an ICU nurse, someone else as well.
Can I ask you, so how long have you been a resident now?
So this is I'm heading towards the end of my first year of residency, and last year I was an intern.
Okay, so you were an intern during the start of COVID, basically?
Yep, pretty much.
So you've been in the system during the whole sort of period?
Yeah, but I've got to say, having worked rurally, we were very fortunate in that the cases didn't get there. When they did get there, it was shut off very quickly.
Yeah.
So that was one of the great things about that. I can't say the same during this year. If I was there this year, it would have been a problem.
Yeah.
Lots of rural locations were like that. They were a little bit overwhelmed with the rates because they didn't have the ICU. They didn't have the space. They didn't have the staff to be able to cater to the needs of a COVID positive patient. That's
how this is something I was wondering, man. How prepped were you for COVID? As in doing an internship of like, you know, just generally like within your specific field of knowledge and your experience going into your residency, you know, for the first year. How much prep did you actually have for, say, respiratory conditions and COVID itself?
So one thing that people forget is when we're talking about respiratory conditions, if you've got COVID and you need to be intubated, doing an intubation, I've done intubations before. I've done them under supervision of a qualified anaesthetist, or you know.
So explain the whole process, basically.
So an intubation is pretty much the best way to explain is getting a tube down someone's airway to support the airway so you've got full control of the airway. You can administer oxygen at whatever percentage that's required, and you can increase the pressures, you can decrease the pressures to inflate and deflate the lungs.
Yeah, and with that, it can't be it's not a permanent solution because
no.
You develop pneumonia after an extended period, don't you?
Well, usually people get intubated because they've got severe COVID. So we'll talk, because it's a different disease and the management's very different, we'll talk specifically about COVID.
Okay.
In regards to COVID, what we're trying to do is we're trying to bide enough time for the patient to recover.
Yep.
And in the patients that I've seen who have had COVID pneumonia and have been intubated, a lot of them don't recover and either remain on the ventilator or pass away.
Yep. When you say remain on a ventilator, you mean
remain until the family is accepting of the fact that they will never recover.
Shit.
And then they're palliated.
What's the turning point? What's the time frame there? Like, let's say...
So from the cases that I've seen, people get sick. Maybe they're sick and they're infectious for 7 to 10 days, something like that. And around that time period, they get super, super sick. They get what we call a cytokine storm that a lot of people, you've probably heard it on the news, like pretty much the immune system goes a little bit crazy, gets a bit overwhelmed, and the lungs just get filled up with all this fluid, and they start developing, all the immune cells start laying down scar tissue, and the lungs get really damaged. And what happens when they get to that point, breathing in normal air isn't enough. So when we breathe in normal air has 21% oxygen. It's not 100% oxygen, it's 21% oxygen. That will not maintain oxygen saturation, so oxygen levels in the blood, high enough to be compatible with life. So what do we do next? When they're not getting enough oxygen via the air that they're breathing in, we put an oxygen mask on. So that's a face mask.
Yeah.
And there's different levels of that. There's low to high flow.
Man, I grew up as a chronic asthmatic, man, so I've had that oxygen mask on my face.
Okay.
Plenty of times. You know what I mean?
Okay, so you've probably have you heard of BiPAP?
BiPAP.
BiPAP.
What the
CPAP. Okay, that's all right. High flow nasal prongs. So really, okay. Well, they're sort of like, they provide, as well as providing 100% oxygen, or a very high percentage of oxygen, they also provide pressure support. So to open and splint the airways open.
Yeah.
Because these, as you'd imagine, if you had if you had a balloon, right? A balloon and you're going to blow it up. If you had a nice dry balloon and you tried to blow it up, it's really easy to blow up.
Yeah, it expands.
If you put a little bit of like a couple of drops of water inside that balloon, all of a sudden the water molecules are sort of attracted to themselves.
Yeah,
and then you imagine how much pressure you need to blow up that balloon. Imagine that's your lungs now.
Yeah.
And there's all that fluid and all that crap in there, and you're trying to expand these lungs. You need a lot of pressure.
Yeah.
But when you give a lot of pressure, you can also cause damage to the lungs. And that's something that we also see with people who are intubated with COVID pneumonia as well. They require very, very high pressures to inflate the lungs.
But not enough to actually leave withstanding damage.
Oh, no. Sometimes they'll get damaged as well. That's what I wanted to bring up.
Yeah.
So
So it's like a balancing act between...
It's a balancing act between giving enough oxygen and giving a high enough pressure to maintain normal oxygen... Oh, not even normal, actually. That's a lie. Not normal. To maintain oxygen saturations that are compatible with life.
It's crazy for you to say that in that way, compatible with life. Do you know what I mean? And I think that's what's been lost on this whole sort of thing, man. Like, we've covered COVID, like, obviously, on this podcast, man. Like, we try not to dwell on it, right? Because it's just been, everyone's sort of had their head done in with it. But people are forgetting that, man, that it's about compatible with life. These are life and death situations. Do you know what I mean?
Yeah.
That's obviously, man, like, so what, say going in, with your first year of residency, man, how did you cope with, like, start with the hospitals itself, man, without naming hospitals. At what capacity are they working at to maintain inbound patients?
Oh, well and truly over capacity.
Yeah?
Over capacity. The health system is always working. I guess it's always, it doesn't matter what time you ask a hospital, it doesn't matter what moment in time, I guess, you speak to someone in the hospital. The hospitals are always working at full capacity. Like before COVID, I'm sure it was very difficult to get a hospital bed. Right?
Yeah, no,
hospitals are always full.
Every time you go to ED, you're sitting there for 5 hours.
The extent to how full a hospital is will determine how many people are allowed to come in to hospital. So, you're, like I was talking about, that threshold goes up depending on how busy the hospital is.
So if you've got a runny nose, like you're not coming in.
Oh, you're never coming into hospital for a runny nose.
If you're bleeding from your ass.
No, even that might, people can have non-severe bleeds. It can be like a hemorrhoid So there's things that, the job of ED is pretty much to figure out what needs to come in and what doesn't need to come in.
Yeah, they do that as spot assessment or whatever it is, and it's like...
Yeah, it's not really a spot assessment. It's more like you do a workup, ask the questions, take a history, do your exam, and then you're like, all right, is this something important? Is this something the GP can manage? Is this something the patient can manage themselves with some advice from yourself and possibly a prescription for some medications? Or is this something that needs to come into hospital? And with the COVID situation, there was so everyone coming into hospital through ED pretty much was COVID and dying. And then everything else was left to the back of the line because it wasn't severe enough. And when I say people are coming into COVID and dying, people are coming in extremely short of breath, unable to breathe from home with an ambulance.
Yeah.
And their partner or someone's calling the hospital and being like, look, this person's gone blue. They can't talk. They're really short of breath. I don't know what to do. Should I come into hospital now? And then usually someone over the phone will be like, call an ambulance, bring him in.
Man, so with these severe cases of COVID, these are all ages, right?
Yeah, so it varies. It's very unpredictable in terms of who it affects.
When all the shit with COVID first started, the whole gist of it was, and this is what the anti-vaxxers and the anti-COVID conspiracy theorists were saying, it's only affecting the old people. You know?
I think with the first variant of COVID that came through.
Are we talking pre-Delta or?
Yeah, pre-Delta. Yeah. I can say that it affects mostly the elderly.
Yeah.
Which doesn't mean it's still not a problem.
Yeah.
Right? It's circulating. It can mutate in variant strains as we experienced. Yeah, I think it was still a threat for young people. You probably heard back then there were quite a few young people in hospital as well that were not doing well.
Yeah.
So again, it was still unpredictable. But with the Delta strain, that just smashed through us. Like, we were fortunate in that we prioritized getting people over the age of 65 vaccinated, because who knows what Delta would have done to them, because it was doing crazy things to people under the age of 65 as well.
Yeah.
I mean, I know of people in their 20s who got intubated. No previous lung issues, no other comorbidities, so no other illnesses, no diseases. Healthy 20-year-olds that have just
collapsed, basically.
I wouldn't say collapsed, but they've come in very short of breath with COVID pneumonia.
To the point where if they don't get hooked up somewhere,
they would likely deteriorate and die. Yes.
That's that point.
That's how bad. Yeah.
See, man, it's weird. I spoke to my mum today, man. I haven't seen her for a while, and I ran into her at the shops, and she said to me that her cousin in Greece just is in the later stages of recovering from COVID, but I didn't even know she had it. And these idiots went 10 days without seeking help, because apparently people with vaccines were dying off quicker than people without them.
Nobody with it.
No. Look, this is what she said. She goes, they were just anti-vaxxers, left her for 10 days until she literally, was at death's door, and she was, hooked up, done, and they're still wondering if she's even going to get out of the hospital without severe damage. It's irreversible. So for you to say that you were looking at 20-year-olds, people in their 20s, healthy people with no pre-existing conditions of, respiratory issues and shit like that, how did that affect you, man? I mean, you're a young bloke, you're not.
Yeah, exactly. And, it's pretty scary because at the time my parents had gotten the, it wasn't until later on that we could, that people were eligible for vaccines under the age of 65. And my parents had gotten the AstraZeneca, and I knew it was a 6-week gap between their first and second vaccines. And I'm like, ooh, what happens? Like, somebody, I don't know, my brother goes to work and
whatever
gives it to them. Who knows? Like, that was quite scary. And it was scary for myself. I'm like, what if I get it? Even though I'm vaccinated, like, my risk is significantly lower than an unvaccinated person to get severely ill with it. But, it's still a very, very dangerous virus.
Yeah.
It's a life-threatening virus. It's a killer virus. And I think, despite that, even as a vaccinated person, I think it is still important to take precautions and to be safe during this period until we, I guess, have more and more solutions and more treatments.
Yeah.
But getting vaccinated is the first step, and it seems to be the most effective step so far.
In the periods when, your hospital will be inundated with, patients coming in, inbound and all that sort of stuff, what was your average sort of work run? Like, what time would you start work? What time would you finish? Were you stopping to take a piss, or were you just holding it for 14 hours? Do you know what I mean?
Yeah, so
it's just for the general front line, basically.
I think it's really hard to say because I was redeployed to a COVID ICU.
Yeah.
And, I was doing a lot of work there as one of the resident doctors. But the patients that are there's not really much you're doing for because
it's too late, or?
Yeah, it's too late. They need oxygen via a tube. They need to be fed via a line. And then you just sit there and change the pressures of their ventilator.
How?
Like, there's really...
Once it's at that point...
They're occupying... Really, all that's happening at that point is you've got a patient occupying a bed. And usually they In a lot of cases, they don't make it if they've gotten to that point. And we do the right thing. You keep them on the ventilator. You see if they recover, but in most cases, they don't recover.
The way I'm seeing it, it's almost like
if they're unvaccinated.
It's like a straight to hospice sort of thing. Like you're coming in and it's like you've punched a ticket and you're just going to make them comfortable until.
For a lot of people, that's the case. There's a lot of people as well that quite a large number of people that needed hospital admission for COVID pneumonia, but they only required that the high flow oxygen through that mask that I was talking about, which is less invasive. But those out of all those patients, they could deteriorate at any point as well.
Yeah.
And who's to say who's to know how they'd be without that oxygen if they were just at home? And we're talking about Australia. We've got we've got one of the best health systems in the world, and we're encountering problems such as that, where where there's people that need oxygen and aren't able to come in to get oxygen.
And something like oxygen. Yeah.
Yeah.
It's not like some random drug that you have to bring in from, Brazil.
Well, yeah. I'm pretty sure I didn't work a lot with hospital in the home, which is just a service that's offered from the hospital to sort of deliver care in the patient's home environment. But that was completely filled with COVID patients. So I think they were taking oxygen to people's homes and oxygen monitors for the finger probe so they can see their levels and see how bad or how good they're doing.
Yeah. When you say like at capacity, what's the average? Like I said, what is the average run for either a resident doctor or a attending nurse or anything like that in a period of you're saying everything. It's always at capacity. So is that literally you're just on your feet dealing with monitoring the whole?
Usually a shift, any sort of shift, you're working from the start to the finish. As a doctor, you usually you get a break, and that break is not a rostered break. It's a break to eat when you get a chance to. When
there's a break in the wall, and
exactly,
you can step away.
Exactly. When there's a break available.
Yeah.
You have to make time for it still. Like you literally have to be like, all right, I've got to stop what I'm doing right now to make sure I eat and drink some water so that I can continue to work. I think one of the big problems with COVID was the PPE. So as you'd imagine, having to gown up, having to it's called donning, getting all your gear on.
You're not wearing
doffing.
Just scrubs.
No. You're wearing scrubs. You're wearing a different set of scrubs every time you go into the hospital that the hospital supplies. And then you are wearing your gown, your gloves, your mask, which is a N95 mask. And if you can probably see in my nose, it's not so bad now. It was bad probably a couple of months ago. But leaves a nice mark around your nose and around your face from wearing it all day. And you're wearing also a face shield.
Yeah, the visor thing.
Yeah, so you're wearing a shield, a mask, a gown, gloves. You're washing your hands multiple times every time you go in, every time you go out. And that's just to do something small, like just have a conversation with the patient.
Really?
Oh yeah. The rooms are usually, so where I'm working, actually, we didn't have enough negative pressure rooms. Pretty much we had to make do with the rooms that we had, the rooms the hospital had, because we didn't have enough, negative pressure rooms where, the virus is less likely to transmit. And because of the air conditioning system and a whole bunch of logistical things related to the hospital, we had to make do and follow obviously a separate set of precautions as well. So I was having like these special, I don't know what they are, little air conditioning things in the rooms and in the wards and so on. But you're doing that every time you enter. The doors are closed for all of these patients. And every time you enter, you have to wear a different set of PPE. So that process alone is, it's just exhausting just to see one person. But then wearing it, you're just warm, you're sweaty, your face is getting hot from the shield, from the mask. It's pretty full on.
I spent a lot of time during the last 18 months arguing with people over PPE. Especially the idiots that came out at the start, trying to say that the shit doesn't work. And
That PPE doesn't work.
yeah,
So vaccines don't work and PPE doesn't work. Is that what they're saying?
you haven't read the news, man? You haven't seen the people protesting down Parliament? Man, I'm glad that you've been away from that because you're actually working to keep people fucking alive. I spend a lot of time arguing with people, man, to the point where, like, you question friendships after half the time, man, because it's like...
Oh, I definitely knew a couple of people that were on the fence of... Well, anyone that I knew that was on the fence in regards to vaccination, I called them up straight up and I told them all about some of the presentations that I was seeing.
Yeah.
And the fact that pretty much, actually all of these let me just start off by saying, I don't think I highlighted this earlier, but all of these patients, pretty much almost all of them, were unvaccinated. I don't know where this bullshit's coming out about people are still getting sick if they're vaccinated. If you're vaccinated and you get COVID, the likelihood of you requiring a hospital admission is very low. The likelihood of you requiring ICU intubation is extremely low. I'm not going to sit here and lie and say that it doesn't occur. It does occur, but it's very rare. I mean, like, you look at a ward full of 40 people and maybe like a handful will have had one jab. And so they're not even fully protected.
Yeah.
And, as I think people forget as well that you're not protected until weeks, or you're not fully protected until, a week or longer after your second vaccination. So it takes some time to build up that immunity even after you get vaccination. You don't just get the jab and now you're immune. It takes some time to develop that. And the people, you barely saw anyone who was within that 6-month period following their second vaccination, unless they were extremely old and extremely unwell to begin with. And I'm talking about the type of people where a cold would really tip them over the edge.
Yeah. How does it make you feel, man, knowing that people were protesting fucking mask mandates and saying it was their God-given right to be free and blah, blah, blah?
Yeah, no. It was actually so... It was... I got to say, it was kind of entertaining to a point, because I was like, I can't believe they are protesting against this. Like, we literally have a killer virus that's spreading around Australia. It's overwhelming our health system, and these guys are complaining about a bloody mask and the vaccine.
Yeah.
Could you imagine? The one thing that always comes to me is, imagine if you were told that there's a killer virus killing people all over the world. It's a global pandemic, and but we've got a solution. We're going to give you a vaccination, and we're going to give it to you for free, right? We're going to give it to you for free, and this will significantly reduce your risk of dying from this illness.
Yeah.
Imagine you refused it. Like, pre-COVID, if anyone gave you this situation, you would straight up be like, oh, yeah, of course I'd take up this vaccination. You'd be a moron not to, but yet we're in the situation and people are protesting. And I guess you know where the protests are coming in, because we haven't seen the worst of it, because we were in lockdown, and fortunately a lot of people were abiding by the rules, and we prevented a serious issue.
Yeah. I use the analogy with seatbelts a lot. My big thing is that people that sit here and argue about masks and preventatives like that, they don't do shit, and the vaccine is all a hoax and fucking blah, 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 and they just want to kill us off and all that sort of shit. I keep having to remind people just how hard the government works to keep you alive.
Yeah.
You know
it's
what I mean?
not in the government's interest to be paying, right? To be just supplying these vaccinations for free if they did nothing.
Yeah.
It costs the government money to have people in hospital getting sick. They want to reduce the likelihood of that happening. So it's feasible for us to provide vaccination to the whole country to keep everyone safe and prevent people going into hospital, prevent people from dying.
It's not, and that's the thing. It's not even with COVID, like in general. It's across the board, from the toys that you give your kids to what the toys are made of. Whether you're going to buy,
there's a lot.
You could buy your son a toy, at Christmas. So much stringent testing has happened to make sure that toy isn't going to kill him. The chemicals in the toy aren't going to kill the kid. The parts that come off it aren't going to get swallowed. you know what I mean, and kill a kid or stab him, you know what I mean? I've worked in importing where I've brought in produce from overseas. The amount of testing we've had to submit, you know, like just yeah, what's this? Where's it come from? Okay, where's all the data behind it to show that it's not going to interfere with our flora and fauna or kill someone coming in off the docks before it's ingested? The amount of shit that the government does behind the scenes and openly to protect the lives of the people in this country. That's what pisses me off, man. So when you're just describing donning and you know, like putting shit on just to keep people, just to have a conversation with a poor bastard in a room, and then you got idiots protesting the mask mandates. You know what I mean?
Yeah.
That's what I'm saying. Like, surely, I mean, you and your colleagues, man, like, you just sit there scratching your heads.
Oh, it's yeah. I guess all you can do is laugh, really. Like, you're just like, I can't believe this is happening. And I guess when people do become severely unwell and end up in ICU and end up on a ventilator, what you find from a lot of the families, particularly because, you know, sometimes you have someone that's a little bit more elderly and, you know, they've got children in their 20s or 30s who they've been the ones who have been like, don't get vaccinated. They're trying to kill you. The government's, it's a conspiracy theory. The government's trying to kill you off as well as everyone else. Don't get the vaccine. They never really come around, even when some do, and especially the patients. There's patients that come in and, you know, pre-intubation or when they're on the highest level of mask oxygen, they're like, can you give us the vaccine now? It's too late at that point. You can't give anything. It's not going to help. But in the other circumstance where things turn around, you see the family members are still believe that the vaccine would not have helped their situation. And you're like, we're in an ICU and everyone here hasn't had the vaccine that's in here. Like, we haven't seen people in your father or mother's state who have been vaccinated. We think the vaccine would have helped.
So clearly, the medical staff working in these facilities have been vaxxed, obviously. They're wearing the PPE and they're not falling off with COVID.
No, exactly.
How are they managing to literally work and operate?
And they always bring it down to something else, or like, oh, we didn't give them ivermectin, or we didn't give them this and we didn't give them that. It's like, well, we're working with evidence-based medicine. We don't give something unless it's got enough proof that it works.
Again, part of the whole...
And there's been trials on ivermectin, and it doesn't work. It doesn't work that well. With the treatments that we currently have, and there's a whole range of treatments, and Alfred's one of the leads in the terms of the treatment of COVID. At the moment, they've got quite a few protocols, and they share those with quite a few hospitals. And I think when you're applying for when you're applying for medications to treat someone with COVID pneumonia, they have to reach a certain criteria in terms of their oxygen levels and so on.
Yeah.
And then you apply for the medication, and the medication comes and you treat the patient to make sure that they get better. So if this treatment's there, they're not amazing. They're the best we've got. Prevention is better than, and it's not really a cure, but I'm going to say a cure.
Yeah. Everyone that's coming in, like all the patients that are coming in, unvaxxed, all that sort of stuff. Like you said, it always comes down to something else having been administered.
Yeah, that's always the argument. It's always like, it's because you didn't do this. It's never because they didn't get the vaccine. And unfortunately, what really gets to me is that I guess these are going to be the people going out afterwards and telling people, yeah, no, the hospital killed my loved one. And you're just like,
So it's mishandling and mismanagement. It's not.
Yeah, and I understand where that comes from as well. You've got to imagine that if you were that person, and you know what, it's not even their fault. I guess it's a system fault, because they obviously didn't have the health literacy to understand that the vaccine is effective. So there's something hasn't gone right along the way, right?
Yeah, you got to remember. Even I'm an idiot. I've got a basic understanding of some of the stuff you're saying. But
no. But some people don't. Unfortunately, not a lot of people have that privilege of, I guess, being exposed to the right people and getting the information from, the right people. And I guess that's why they might refuse the vaccine and might not believe that it works.
So how do you actually feel when you see people you consider to be intelligent people making educated decisions in their lives coming out and just rehashing all the conspiracy shit about vaccines, masks.
I can't even comment on that, but we'll go back to that. We'll go back to the family issue, and you'll notice that what I wanted to say was I kind of get where they come from in the end, because they must be feeling some sort of guilt.
Yeah.
And the only way to, I guess, rid yourself of that guilt is not to accept that the fact that they weren't vaccinated is the reason why they've become so unwell, but to, believe that it had nothing to do with it.
Yeah, they're looking for a scapegoat. Because,
how are you going to, because how would you get around it? How would you live with yourself otherwise?
Yeah. What about the actual patients themselves?
Are
they finding remorse in the final sort of hours, or are they still fighting?
I've heard quite a few stories of people literally just breaking down in ICU, being like, I should have gotten the vaccine. I don't know why I didn't. There's people who get to that stage, yes.
Yeah.
And then it ends up with family problems. They start hating people in their family because they're like, they told me not to do it and I listened to them, and look, the situation I'm in. A lot of back and forth like that, but ultimately the really bad ones, they can't talk.
Yeah.
Because they've got to, because
what
they're
about
intubated.
what about mental health debriefing, man, for all like frontline workers and stuff?
Oh, that's done really well. So whenever
are you finding support in that sort of thing? 'Cause, man, just listening to what you would have to be dealing with, man, I'm getting broken up.
Yeah, no, everyone's there for each other though. You're always working with such a great team, and even when you are overwhelmed, everyone's helping each other and doing their best. And everybody, doesn't matter what their beliefs are, doesn't matter what their background is, vaccinated or unvaccinated, they get treated the same.
Yeah,
and they get treated well. And we respect everyone. It's just unfortunate that there are a lot of people who are becoming so unwell who aren't vaccinated.